A resident with advanced dementia suddenly begins undressing in the dining room. What should the CNA do first? A. Scold them quietly. B. Gently guide them to a private area. C. Restrain their hands. D. Ignore the behavior. Answer, B. Public disrobing is often caused by confusion or discomfort. The CNA's first priority is dignity, privacy, and safety. Redirecting to a private area prevents embarrassment and allows assessment of why the behavior occurred. A resident with new oxygen tubing shows redness behind their ears. What is the CNA's best response? A. Loosen the oxygen flow. B. Apply a barrier pad and report the pressure area. C. Remove the tubing until skin heals. D. Ignore it unless skin breaks. Answer, B. Tubing pressure can lead to skin breakdown. CNAs must pad the area to relieve pressure and report changes before wounds occur. During morning care, a resident repeatedly asks, "Where is my mother?" even though she passed away years ago. The CNA should A. Remind them firmly that their mother is dead. B. Change the subject using gentle redirection. C. Leave the room to avoid upsetting them. D. Tell them to stop asking. Answer, B. Directly correcting a confused resident may cause emotional distress. Redirection supports emotional comfort and reduces agitation. A resident requires contact precautions for C. difficile. The most important step before leaving the room is A. Touching the call light. B. Washing hands with soap and water. C. Using hand sanitizer only. D. Removing gloves outside the room. Answer, B. Diff spores resist alcohol-based sanitizers. Soap and water physically remove spores, preventing facility-wide spread. A resident with a history of falls insists on walking alone to the bathroom. The CNA should A. Allow them since they are independent. B. Block the bathroom door. C. Explain risks and offer scheduled toileting. D. Lower their fluids. Answer, C. Respecting autonomy while promoting safety means providing alternatives, like scheduled toileting, to prevent unsafe attempts. A resident on a pureed diet complains, "I want a sandwich now." What should the CNA do? A. Give the sandwich anyway. B. Explain the diet and report refusal to the nurse. C. Hide all food choices. D. Say nothing and walk away. Answer, B. Giving unsafe food may cause choking. Educating and reporting ensures dietary compliance while addressing frustration. A resident suddenly becomes cold, pale, and sweaty during ambulation. The CNA should first A. Increase walking speed. B. Lower them to a safe seated position. C. Leave them to call for help. D. Give them juice. Answer, B. These symptoms suggest fainting or a medical emergency. Support and sit them safely before anything else. A resident with limited mobility tries climbing over the side rails. The CNA's best action is to A. Raise all side rails. B. Lower the bed and remove unnecessary rails. C. Move them to a different room. D. Tie their hands to prevent climbing. Answer, B. High rails increase fall severity and entrapment. Lowering the bed and minimizing rails reduces risk without restraint. A diabetic resident says, "I feel shaky and hungry." The CNA notices their hands tremble. The CNA should A. Call the nurse and provide a quick sugar source. B. Force them to lie down. C. Withhold all food. D. Document later only. Answer, A. These signs indicate hypoglycemia. The CNA must report immediately and offer fast-acting carbohydrates if allowed by facility protocol. A resident is coughing violently while eating but can speak in short sentences. The CNA should A. Perform abdominal thrusts. B. Encourage coughing and observe. C. Hit their back repeatedly. D. Offer water immediately. Answer, B. If the resident can still speak, their airway is partially open. Encourage coughing rather than performing thrusts prematurely. When assisting a resident with urinary retention, the CNA notices the output is very small since morning. The CNA should A. Increase their fluids without permission. B. Ask the resident to drink coffee. C. Report decreased output to the nurse. D. Ignore unless painful. Answer, C. Low urine output may indicate dehydration, infection, or obstruction and requires immediate reporting. A resident refuses to participate in ROM exercises due to pain. The CNA should A. Force the movement gently. B. Stop and report pain to the nurse. C. Document only. D. Perform faster movements. Answer, B. Pain indicates potential injury or inflammation. CNAs must stop and report, never force exercises. A resident with hearing aids keeps answering questions incorrectly. The CNA should first A. Ask the nurse to remove the aids. B. Check if the hearing aids are turned on. C. Speak loudly. D. Move to another room. Answer, B. Poor hearing often results from improperly functioning hearing aids. CNAs must check placement and power. A resident repeatedly hits their call light every 5 minutes but appears calm each time. The CNA should A. Disable the call light. B. Ask why they feel the need to call so often. C. Ignore the calls. D. Move them to another hall. Answer, B. Frequent call light use may indicate anxiety, loneliness, pain, or unmet needs. Understanding the reason improves care. A resident's catheter bag is filled with dark, cloudy urine. The CNA must A. Empty it and ignore the color. B. Report the changes immediately. C. Disconnect the tubing. D. Add water to dilute. Answer, B. Cloudy or dark urine can signal infection or dehydration. CNAs must report abnormal appearance. A resident with dysphagia starts pocketing food in their cheeks. What is the CNA's best response? A. Remove the food and notify the nurse. B. Force them to swallow. C. Serve larger bites. D. Give them water quickly. Answer, A. Pocketing increases risk of aspiration. Food must be removed carefully and reported for immediate dietary reevaluation. A resident refuses their afternoon ADLs, stating, "I want to rest now." The CNA must A. Force care. B. Respect their choice and return later. C. Report them to the administrator. D. Tell them the schedule cannot change. Answer, B. Residents have the right to refuse care. CNAs should honor this and attempt later. A CNA notices that a resident's dentures no longer fit and cause sores. What should the CNA do? A. Stop providing meals. B. Report the ill-fitting dentures to the nurse. C. Remove them permanently. D. Force the resident to wear them. Answer, B. Denture sores can lead to infections and nutrition problems. CNAs must report immediately for dental follow-up. While assisting with dressing, a resident on hospice says, "I think today is my last day." The CNA should A. Tell them not to talk like that. B. Listen calmly and offer emotional presence. C. Change the topic. D. Leave the room. Answer, B. Hospice residents need emotional validation. Supportive presence is essential to their comfort. A resident with neuropathy states they cannot feel their feet. The CNA should A. Massage deeply. B. Check for injuries or redness and report. C. Encourage long walks. D. Ignore unless painful. Answer, B. Loss of sensation puts residents at risk for unnoticed injuries. CNAs must look for damage and report promptly. A resident with a new prosthetic leg says the stump feels burning and tight. The CNA should A. Remove the prosthesis and report. B. Force it back on. C. Ignore the complaint. D. Ask them to walk more. Answer A. Burning/tightness may indicate poor fit or skin breakdown. Removing it prevents injury. A CNA overhears staff gossiping about a resident's diagnosis. The CNA must A. Join the conversation. B. Report the breach of confidentiality. C. Repeat it quietly. D. Ignore it completely. Answer B. Gossip violates HIPAA. CNAs must report privacy violations immediately. A resident starts breathing very rapidly and appears anxious. The CNA should first A. Call a code. B. Help them use controlled breathing and stay with them. C. Place them flat. D. Give them water. Answer B. Staying calm and guiding breathing reduces anxiety while the CNA alerts the nurse. A resident becomes combative during a shower. The CNA should A. Restrain them. B. Step back, ensure safety, and attempt calm redirection. C. Continue showering quickly. D. Yell for them to stop. Answer B. Combative behavior often stems from fear or discomfort. The CNA must ensure safety and use soothing redirection. A resident complains that their roommate keeps taking their belongings. The CNA should A. Ignore unless theft is witnessed. B. Report the concern and help label possessions. C. Accuse the roommate directly. D. Move belongings without permission. Answer B. Labeling items and reporting protects resident rights and prevents conflict. A resident is on fluid restriction but requests more water. What must the CNA do? A. Give the water secretly. B. Explain limits and offer allowed alternatives. C. Increase fluids to satisfy them. D. Throw away their cup. Answer B. Fluid restrictions protect heart/kidney function. Alternatives like ice chips maintain comfort safely. A resident becomes withdrawn and stops participating in activities. What should the CNA observe for? A. Depression or pain signs. B. Low blood pressure. C. Hunger. D. Medication refill date. Answer A. Withdrawal is often linked to emotional or physical distress, which must be reported. A resident with COPD becomes short of breath after walking 10 feet. The CNA should A. Force them to continue. B. Stop activity, help them sit upright, and notify the nurse. C. Lay them flat. D. Give them water. Answer B. Upright positioning improves lung expansion. Activity must pause immediately. A resident says their family never visits anymore, and they cry during care. The CNA should A. Ignore the emotion. B. Offer support and notify the nurse of emotional distress. C. Tell them their family is probably busy. D. Tell them to stop crying. Answer B. Emotional changes must be reported. Residents need compassionate support. A resident with a PEG tube has feeding formula leaking around the site. The CNA should A. Clean the area and immediately notify the nurse. B. Push the tube deeper. C. Ignore unless painful. D. Tighten the tube manually. Answer A. Leakage indicates displacement or irritation. CNAs must clean and report, not adjust tubing. A resident insists they already received their medication today, but the medication nurse says they did not. The CNA should A. Side with the resident. B. Encourage cooperation and report confusion. C. Tell the resident they are wrong. D. Administer medication. Answer B. Confusion about medication timing is a sign of cognitive changes and must be reported. A resident with limited vision grabs for objects while walking. The CNA should A. Allow grabbing. B. Walk slightly ahead and offer guidance cues. C. Turn off lights for comfort. D. Make them walk independently. Answer, B. Guiding reduces fall risk and supports confidence. A resident with dysphagia starts clearing their throat repeatedly during meals. The CNA should A. Ignore it. B. Stop feeding and inform the nurse. C. Give larger bites. D. Offer water quickly. Answer, B. Throat clearing suggests aspiration risk, feeding must stop immediately. A resident with arthritis refuses to use their walker despite instability. The CNA should A. Argue until they agree. B. Explain the safety benefits and report refusal. C. Hide the walker. D. Walk away. Answer, B. CNAs cannot force devices, they must educate and report unsafe refusal. A resident frequently wanders into other rooms. The CNA's best approach is to A. Yell at them. B. Redirect with meaningful activities. C. Lock them in their room. D. Follow them continuously without speaking. Answer, B. Wandering is often reduced through purposeful engagement and gentle redirection. A resident with a new colostomy asks, "Is the smell normal?" The CNA should A. Ignore the question. B. Reassure them and report concerns to the nurse. C. Tell them to stop complaining. D. Remove the pouch. Answer, B. Emotional support plus reporting physical concerns helps adjustment to new ostomy care. A resident develops a rapid change in behavior, refusing meals and becoming verbally aggressive. The CNA must A. Assume it's normal aging. B. Report sudden behavior changes immediately. C. Argue with them. D. Isolate them. Answer, B. Sudden changes may indicate infection, delirium, or pain and require urgent evaluation. A resident spills hot coffee on their hand and skin appears red. The CNA should A. Apply ice directly. B. Cool the area with lukewarm water and notify the nurse. C. Cover it tightly with a blanket. D. Do nothing. Answer, B. Cooling reduces tissue damage, ice can worsen injury. Burns must be reported. A resident insists on smoking immediately after using oxygen. The CNA must A. Allow it outside. B. Remove oxygen without permission. C. Report the safety risk immediately. D. Offer gum instead. Answer, C. Oxygen plus smoking equals explosion risk. Must report immediately. A resident says, "I feel like I'm going to pass out," and becomes pale. The CNA should A. Stand them up straight. B. Lower them safely and call for help. C. Splash water on them. D. Leave to find another CNA. Answer, B. Fainting symptoms require immediate support to prevent falls and rapid notification.